Sounds like me at home. Yes, dear. Default answer. Yeah.
They might be. Ready? Okay. I'd like to call this meeting to order. Please rise for the Pledge of Allegiance. Got a moment of silence. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Roll call, please.
I would ask commissioners to adjust their microphones. Commissioner Ansorgi.
Here.
Commissioner Rushton.
Present.
Commissioner Bunnick.
Here.
Commissioner Wessel.
Here.
Commissioner Sotis Little.
Here.
Commissioner Rentenbach.
Here.
And Commissioner Lautner.
Present.
All present.
Thank you. So that brings us to communications, proclamations, and presentations. And we have today the Benzie Health Department. Lisa's here, please. Hello. Good evening.
I have a few little packets.
I'll pass them out.
Pass them around. Thank you, Chet.
Thank you.
Hi, everyone. Thanks for
Hello.
giving me some time on your agenda this month. So I am Lisa Peacock. I'm the health officer with the Leelanau District Health Department. And I'm here tonight to give you our annual update, present our annual report, and answer any questions that you have about the health department services. So I brought some packets of information for you because I think it's a really important part of my job to convey to you the importance of public health services, to keep you up to date on the work that we're doing in the community, and to make sure that you're aware of challenges that we're facing, successes that we're having. In Michigan, we have an awesome decentralized model of public health services. And so we really like that. We like that the state delegates its authority to the counties to provide public health services. And we like being a district health department that's organized in an agreement between two counties that cooperate together. And we like being your boots on the ground, providing these services in the community. So, you know, I thank you for that opportunity. And with that, because it really is your public health services that we're providing, I think it's really important that you're aware of the current issues that we're facing, and that we make sure that we relay to you those things that we're advocating for. So in the packet, I included some advocacy materials that we have shared, and our Board of Health members, thank you, Peachy and Melinda, for many years of service on our Board of Health, and for giving us guidance and helping us, you know, move along through our public health services and supporting the work that we do and being willing to learn about it. Am I making all that feedback?
We'll blame it on you tonight.
We don't too loud. It's like every time I breathe.
Spread them apart.
Oh, okay. Thank you. I just don't want to drive you people's ears crazy. So in the packet are some advocacy materials that we use when we go and talk to state legislators about public health services. You know, this one that talks about investment in local public health, you may have seen before. Certainly our Board of Health members have seen it before. But it talks about the services that we're mandated to provide, and those are often our silent services. They're the things that, you know, in the second paragraph of this document, it talks about the things that don't just happen. That public health is at work in the background, and sometimes these problems we forget about because they're not happening because of our work behind the scenes. So we feel it's really important to remind the public, to remind you, and to remind our legislators how important it is that we are, you know, fully funded to be able to do those things. Chronic underfunding does threaten our work, and we are chronically underfunded from the state. And so your voice with the legislators and understanding these issues and this chronic underfunding is really important to us. So I'm hoping to arm you with those tools, that when you're having those conversations, you know what to say to them, and the risks that we have when we are underfunded. So in addition to this pamphlet, I also gave you some talking points and an elevator speech about public health services in general. So those are just for you to have, to give you some information and those discussions that you may be having with community members or with state legislators. And hopefully they'll give you some background in a summarized way so that you can share that information. Another thing that we try to do in public health is be really fiscally responsible with the funding that we do have. We try to do a lot with a little. And we have, included some information here on return on investment. For every dollar that we invest in certain public health services, there's a significant return on investment. Hearing and vision screening that we do in the schools throughout both counties really results in identifying hearing and vision problems early, which allow children to begin learning in school and, really make tracks toward having a healthy adult life. They are able to have those vision and hearing problems corrected early, and it's a significant cost savings for everyone when that happens. We also, talk a little bit about the things that might be costly in terms of health and dollars if we didn't have public health services. Foodborne outbreaks, childhood diseases that have been essentially eradicated due to vaccines. And just a couple of examples like a West Nile outbreak and the Flint water crisis. So we advocate for public officials to consider health in all of their decision making, to make sure that everybody is aware that health is ultimately implicated in every decision that we make. So we hope that this information is helpful to you. The other document that I provided for you is just a summary of some emerging health threats that we're working on. So these are public health priorities. The issue of recreational marijuana use now being legal in Michigan, the public health concerns around that are for our vulnerable populations. So our concern is harm reduction for those who are most at risk, and that would be youth, children, and pregnant women. And so this just gives you some statistics and some information. We're talking a lot about this in our county Substance Abuse Prevention Coalition that Commissioner Rushton co-chairs, and I participate in as a member of the health department. And then also our opioid crisis. This is a problem that is rising like crazy. We had a summit here in Traverse City a couple of weeks ago, and when you see the maps of how the numbers of overdose deaths are increasing, starting down in Ohio and crossing those state borders and moving up, it's just alarming. It's really alarming. And so, we're working on lots of things in prevention, treatment, making sure that resources are available for people so that they don't, so that they can continue treatment and that they don't have barriers get in their way of being able to do that. But also just really raising that public awareness around those issues. Opioids, the risks of marijuana use, the risks of vaping. So that's high on our radar. PFAS is the man-made chemicals that we're finding in drinking water, and that is something that is being tested all over Michigan. And there's a lot of science that we don't know about PFAS, and so we're probably going to see some of those thresholds changing regarding, the levels and that kind of thing as they learn more, as more science is available and more research is done. We may be seeing things like that. So keep that on your radar. We'll continue to be available to answer questions about that. Eric Johnston, our EH director, is on top of that, involved in state work groups and trying to stay on top of that issue. Vaccine preventable diseases continue to be a really important public health concern. We have, this is way outdated. The numbers I think are closer to 200 for our measles outbreak in Michigan now. So we have had one case in northern Michigan in our neighboring county of Grand Traverse. Not a single case developed from that case. And so I think that that's really important for you to know that is strong public health at work and strong partnership between the health department and the hospital, who knew what to do when that patient presented to make sure that no one else was at risk. They were screening for travel, they were screening for the symptoms, and they knew how to isolate that patient immediately until the test results were known. So we're really proud of that. And a success of the Grand Traverse County region is a success of ours, because we know that measles virus can spread like crazy. And it's amazing, really, that we didn't have further outbreaks. So we appreciate your support in helping us to do that work, because it is really, really important. And what we say to state legislators when we talk about chronic underfunding is, we don't think about measles when it's not happening. We think it's been eradicated, but boy, it takes just 1, 2, 3 cases to start a full-blown outbreak, and then everything changes. And if we don't have the funding to staff up and respond to those risks, then that's a really big concern for us. We have to be able to mobilize really quickly when those things happen. So, the social...
If I can stop you right there, I've been reading about these different things that we're seeing across different other nations, but because we are a traveling society, we actually are, those are real threats to us because of the travel that we do in this country. And when you look at the Ebola, that's widespread throughout Africa and some of those countries, the chances of that coming here in the United States is it's a potential risk.
Absolutely.
So how has the health department looked at those different specific issues that we see worldwide? What kind of pre-planning does the health department have in regards to those vector-borne diseases that may come?
Yeah, absolutely. That's a great question. We do that's a lot of what we do in our public health emergency preparedness planning. And in Benzie and Leelanau, we partner with 2 other health departments we have a really strong public health emergency preparedness team. We work with Grand Traverse County Health Department and Health Department of Northwest Michigan to assure that those preparations are in place. So all of us have an Ebola plan. When that outbreak first started a number of years ago, we had to, assume a plan and be ready for travelers to come back and assure that, we were identifying that quickly and preventing the spread and all of that. And it still comes up, not in this district, but in my other district, the Health Department of Northwest Michigan. We did have a recent traveler return who was a nurse who volunteers in caring for people with Ebola in Africa. And it's really, those plans are really important, and you really have to keep them up to date because players change. So in that case, we had to be talking to the hospital, to EMS, to assure that everybody who was in place now, who may not have been part of the planning initially, knew what to do if she developed a fever in the middle of the night. We don't have to go and take her temperature anymore. That was sort of the initial response to that. They've kind of changed those guidelines a little bit, the CDC has, but we had to have a daily contact with her where she took her own temperature, reported it to the health department, and we assured that she wasn't developing any symptoms and that she was quarantined for the amount of time that she needed to be.
Well, fortunately, she was a nurse and she was aware of the signs and symptoms, and but I think a lot of times we lose sight of that we do have a traveling population.
We sure do.
And that brings a lot of unforeseen threats to our communities.
And many of these measles cases, that's what it is. It's unvaccinated children or adults who travel to other countries where measles is not eradicated, and they pick it up and bring it back. And there are immune-compromised people who can't be vaccinated. There is certainly not 100% coverage of any vaccine, and the fewer people we have vaccinated, the lower our herd immunity is, so we have holes in the fabric of our protection, and it can contribute to an outbreak.
Has there ever been any conversation in regards to what we as a commission would do in the event? Because I don't know, personally, I have received no information from the health department as to what our role might be if there were to be an outbreak, even measles, So I'm just wondering if we shouldn't have a conversation about that at some point, so that we as commissioners know our specific role as an outbreak would occur.
Yeah, absolutely. We can have a conversation about that. Our Board of Health members might be a little bit more familiar with what happens in that situation, because it did happen during the H1N1 outbreak. And what generally what are the general implications are that sometimes we have to shift resources. And so within the health department, what happens is staff maybe have to do a job that's different than they're used to doing. We all of a sudden have to staff up mass vaccine clinics where we can get people vaccinated very quickly. And so our public health techs that might be working in a clinic or a nurse who's doing home visiting is going to get shifted to that highest priority. We may need additional funding and some emergency funding or that kind of thing, which the commissions would have to consider. Our Board of Health may need to approve a different staffing classification if we had to hire on, additional staff to be able to handle the capacity of that. Sorry.
Commissioner Wessel.
So.
A question from last week's Record Eagle. I think 7% was the figure we got for kids entering school opting out of vaccination. Is that Leelanau County being way at the bottom of the county rankings?
Yeah,
Can you explain that?
Sure, yep. We have one of the highest immunization waiver rates in Leelanau County in Michigan. So we were first, that article quoted second. We just got some new information today that we haven't had a chance to analyze yet, but it's right up there, and it's almost 10% actually, it's 9.9%. And so that would be, the number of children of parents who are choosing to waive immunizations for their children. They do have to come into the health department and receive education so that they're making an informed decision about that. But yes, we do. We have a high waiver rate that concerns us, especially with the measles outbreak or measles case right next door, that could potentially put our community at risk. So, the strategies around that really are trying to provide community education. We want those educational sessions to be productive. We don't argue with people. We don't try to change their mind. We try to give them all the information that we can so that they are making an informed decision with all the information that they need. Research has kind of shown that people who have made up their minds and that come into the waiver appointments typically don't change their minds. So we're not trying to change their mind. There are people though who are on the fence. There's a good percentage of those people who are on the fence and just don't have all of the information. And so we encourage them to bring their children with them so that if they do decide to immunize, they can do it right then and there and we don't have a missed opportunity. So we try to be a really friendly open door so that if they decided not to this time, they might, change their mind later and come back to us for information. But that's a really important fact about Leelanau County, yes.
Thank you.
Another couple of documents that I wanted to point out to you in the folder are about our fiscal picture and landscape and our county appropriations and how we use those dollars. I think it's really important for you to understand how we use the dollars that you allocate to us for public health services. So this bullet list really talks about where we use it gives you a description of the programs where we use local dollars. We really try to prioritize the use of local dollars for programs where we can maximize the impact of that money. A lot of our programs can be matched with Medicaid funds. And so often, if we have a choice of where we're going to use our local dollars, we'll put them into programs where we can really access a 50-50 match. So if you give us $7,000, they're way oversimplified, but can essentially make it $14,000. So we try to do a really good job of strategically determining where those dollars are used. We certainly have our mandated services that have to be covered, and we do make sure that we cover those. Often we have grants and things like that that can be used. We certainly receive some money from the state through our contract. So local dollars can be matched. So local grants, local appropriations, not funding that originates federally. There are rules around that. So this kind of gives you an idea of the programs where we use them, and really almost 70% of our local dollars are matched. So thanks to Dodie, she does a great job of maintaining that, and Michelle. Dodie and Michelle are here with me tonight, by the way. So our Personal Health Director, Michelle Klein, and our Administrative Services Director, Dodie Putney. Sorry, I should have introduced them at the beginning. On the back, we talk about how we try to be fiscally responsible with the funding that you give us. Some of the things that we have been working on is, cross-jurisdictional sharing is really important to our health department. We are part of a Northern Michigan Public Health Alliance. I've mentioned that to you before, you're probably all aware of it. But it's a partnership of 7 local health departments in Michigan. And together, we really strengthen each other. We try to build best practices, spread efficiencies, strengthen each other. We basically cover, we say, from knuckles north to the bridge on the hand. So it really is a large collective voice in Michigan. And I think that when we are all speaking one language together, people listen, and the state is listening. Some of our initiatives that we need continued funding for, they're listening to that. So one example of that is we do engage in, educational activities with our legislators, with the directors of MDHHS, and at our last Public Health Alliance meeting, we met in Cadillac. We rotate locations for each of the health departments. But each of us is responsible for inviting our local legislators to those meetings. That's an advocacy strategy we've been working on this year. And so at that meeting, Senator Vanderwall came, who is the chair of health policy, and really listened to our concerns and our priorities, and we had a chance to listen to his. So that was a really productive meeting. There is some funding for our Community Connections program. We're part of 5 community health innovation regions in Michigan. Our grant from CMS is ending in January of 2020, and so we are working toward a sustainability plan, and part of that is continued funding for the backbone organizations, which in our counties are the health departments. There is funding in both the state and House budgets right now, and we certainly wanted Senator Vanderwall to be aware of that and to make sure that that stays in there. So it was really great to have that opportunity to talk to him. We also hosted at that meeting Director Gordon and Deputy Director Caldoun, Dr. Caldoun. They are the new MDHHS director of the whole department, and then the medical director, who is now in charge of Medicaid and all of the public health services. And so we were able to talk to them about the work that we're doing in the Northern Michigan Public Health Alliance and in all of our counties. So we really try to work hard to make sure that we're heard, and that the concerns of our constituents in these counties are heard. So through those cross-jurisdictional sharing arrangements, we're able to work together in a couple of different ways. One of the very first arrangements that was worked on in the Alliance was the arrangement between Health Department of Northwest Michigan and Leelanau District Health Department to provide shared administrative staffing. So that's my position, and Dr. Meyerson, our medical director's position. And so the costs for those positions are split between the 2 health departments. The Health Department of Northwest provides 70% of the funding for my position. Leelanau provides 30%. And those are based on population. But that's a huge cost savings for both of us, and a huge opportunity for alignment and strengthening of both health departments. We share a lot. Just today, I called Northwest to see if they could run some reports that we aren't able to run yet in our environmental health software, for Eric to be able to make some decisions that he needs to make. And those areas of crossover are really important in being able to do things efficiently and carefully. So we're writing lots of grants. That's been one of our goals. Maximizing fiscal responsibility was one of our strategic directions in our strategic plan. We're halfway through our strategic plan right now. And one of the goals that we had was to increase our cash flow. And so writing grants is a great opportunity for increasing revenue. And so, so far this year, we've secured almost $350,000 in grants. Yeah. So, kudos to Rachel Pomeroy, who is our PIO, our Public Information Officer, who's a health educator and doing a lot of that grant writing. So we're looking for opportunities to improve population health through reducing risk for chronic disease, substance abuse prevention, behavioral health services, those kind of activities addressing those top needs. We have made some changes with our employee benefits. We have increased our private insurance billing. We're investing in technology improvements. We're really looking at digitizing our environmental health records. We have some different funding opportunities, so we're very seriously getting quotes. I think Eric's gotten 4 quotes so far to look at what is the best, most feasible way to do that, and then how much is it going to cost, and how can we seek funding. So we are looking at some grants and some local groups that are interested in that. We may be returning to you to ask for some help with that, but it would be a huge public service to have those public records readily available in electronic format for people to see. So we do group purchasing whenever we can for lots of our clinic supplies. Immunizations are a great example of that. And so you can just kind of take a peek at that. The last document in that packet I wanted you to see is this document that has the pie chart on it. And that one couple of things that I wanted to point out there. If you see on the expenses, obviously the biggest part of our cost are our employee expenses, so salaries and fringes. And you know, I think it's important to note that between salaries, wages, fringes, and contractual, which are our health officer, medical director, and nurse practitioner, that, you know, that is where our spending is, and that is because it is the most important part of our organization. Those are the boots on the ground that carry out the work that we do. Our spending in all of the other areas is very low in proportion to anything like that. So we try to be very careful with the funding that we have. And then one thing I want to point out about the revenue for the health department is that it's, you know, there's a lot of different colors in that pie. And I think that's important to notice that our funding is diversified, and that is purposeful. It gives us some stability as a health department. Our staff are cross-trained in lots of different program areas, and that's hard for them. They have to understand, you know, they have to learn a lot of program requirements, they have to keep up with a lot of information, but it helps us be able to weather some storms. If funding is cut in one area, usually it doesn't mean someone's whole position. It might mean part of an FTE or part of this FTE, and we can, you know, support it with other work. But that's a really important public health strategy. And we learn from each other in our alliance health departments and how to do that and how to work through some of those challenges. Because our funding, you know, from the state and grants goes up and down all the time. So you can see kind of at the 1 o'clock area, my goodness, so sorry. Our billing revenue, first, second, and third party collections, those are fees and billing revenue. We're always trying to increase that, and that really has increased a lot in recent years since we've started billing commercial insurance for whatever services that we can. If you travel down to like 3 o'clock to 5 o'clock, that's our state contract where it says CPBC and Essential Local Public Health Services. That's the money that we receive from the state to provide those services. The blue pie down on the bottom, the kind of the 6 o'clock area there, is our match. And one thing that's really interesting about the match, that's our Medicaid match through either Medicaid outreach funding or Medicaid cost-based reimbursement for billable services. If you look up to the 11 o'clock area where it says local appropriations, you can see that our local appropriations are a small but really important part of our pie because that match is almost equal. So, you know, that's way oversimplified, but it really is important. Your funding that you provide in local appropriations for public health services does really double when we match it. And then other funding and local grants are some of our contracts with Health Department of Northwest, Healthy Futures, Parenting Communities, and then local grants are grants that we might write to Rotary or local fund or community foundation and those sort of things. So those are all the extra documents that I brought you tonight. And then finally, our annual report is this document. And we try to change it up a little each year so that it's not too boring. And also, you know, that it matches sort of our goals for the year. And one of our goals, like I said, is maximizing our financial resources. So we really scaled it down a little bit because we wanted it to be maximal readability, be able to be digested at a glance, and also to maximize resources and reduce the amount of printing costs and that kind of thing. So in here, as you flip through it, and I won't read it to you, I'll just let you flip through it, but we talk about our theme in this annual report is really about back to basics, and that's sort of been our theme of advocacy with the legislators too, that if we don't have this base funding, then it's harder to weather those storms, respond to those outbreaks, respond to air and water contamination, and the things that come up. Our mandated services are listed here, and there are some numbers so that you can see, you know, how many people are receiving those services. And then personal health, non-mandated, is just a highlight. It's not all of our programs. It's a highlight of some of the most common programs and services that we provide. And then at the staple on the right, we have our personal health highlight. We hear so many great the words of feedback from the community, and so we wanted to share some of those with you and with the public. So there are some quotes there about how our awesome Community Connection staff has helped people with their social determinants of health barriers. And then environmental health programs also have some non-mandated programs, but programs that are really important for our area. beach monitoring, campground inspections, things like that are really important to our tourist industry, important to keeping this a safe and happy place to live and visit. So we do want you to know about those, and we want you to see those as a highlight. And then the environmental health stories are really interesting, especially the first one that talks about the crossover between our public health nurse and our environmental health sanitarian who worked together to really help a family that was having some trouble. And then the 2017-2018 financial summary is on the back. So I think with that, I will stop talking, and I'm happy to answer any questions you might have. Thank you. Thank you.
Commissioner Rushton.
I wanted to ask, as an agency, I would think annually you look at certain priorities that your agency would like to focus on. We all recognize that you have a mandated slate of duties. How does the health department determine what their priorities are for that year?
That's a great question. A couple of different sources. One I've talked about a little bit, the strategic plan, and those strategic directions spread over 3 years and are more related to organizational goals. So maximizing financial resources, building a healthy workplace culture, and increasing the health department visibility in the community were our 3 strategic directions. Another really important source of information for priority setting is our community health needs assessment and improvement planning process. We do that, and that's another project that I should just come and present, and I will be happy to do that at another meeting to present the findings, because we just completed the community health needs assessment and are in the process of completing the improvement plans. But that is a coordinated effort across the 31 counties. It's called My Thrive. And all of the health departments, all of the hospital systems, all of many FQHC providers, community agencies are involved in that process. And the 2 main priorities that emerged regionally, we set priorities regionally, and then we set priorities in smaller groups of counties. The regional priorities this year were behavioral health and substance abuse, and social determinants of health or basic needs. So those will be 2 of the priorities that we'll be focusing on, hence the grants that I was talking about in our Community Connections program and our work with substance abuse prevention. So, and then another source of priority setting is through our performance management system. That is a new thing for the health department. We're just getting some technical assistance from the state on that. But that is a way of setting very specific measurable goals for each of our divisions and for our health department in general. And so we look at both the community health needs assessment, the strategic plan, and other priorities that are important to our region and our counties, and then we set specific goals. So I can present that, and that will be presented to the Board of Health as well. So Melinda and Peachy will both have information on that to bring back. Does that answer your question?
It does. You know, when you look around, and you said you're just a piece to a larger puzzle, especially in our northern Michigan. And when I look at Leelanau County and some of the statistics that come out in Leelanau County, they're very favorable as compared to other communities that lack resources or just different things. So I was wondering, you know, if there are is there shared funding maybe that may come from our health department that goes to another department? I mean, no. So funds that are allocated here stay here.
Yeah, the only time that funding is shared, and funding is shared sometimes, but it's in the process of writing a grant on behalf of the Public Health Alliance.
Okay.
And then, you know, like Benzie Leelanau wrote a grant a couple of years ago. We're in the 2nd year of the grant to create a sustainability plan around a program called Mom Power, which is a behavioral health intervention for moms who have experienced some sort of trauma. And so we wrote that grant to the Michigan Health Endowment Fund on behalf of the Public Health Alliance. And what we did was we served as the fiduciary, and then we contracted out funding to different sites, 4 different sites, I think, across the region, to implement a manpower group and develop partnerships in the community and create this sustainability like manual for it, so that we could, they funded us to figure out how we could make that sustainable in our communities. And each community is a little different, and each community has different resources, so each one is a little different, and together we kind of come up with the right answer for how do we continue after the grant.
I appreciate the work you do.
Oh, thank you.
Commissioner West.
Apologies for asking another question, because I know but I see in your report, 8% of Benzie County's budget of $6.5 million or so goes to the health department, and 11% of our budget, which is twice the budget of Benzie. Are we getting more services then for our residents, or is the cost more? I'm trying to understand that.
You have to understand that. Do you want to help me with that a little bit, Debbie, on the history? The difference between the Benzie and the Leelanau support of the health department?
See, it's based on
Kind of historical.
population. The breakdown is based on population.
number.
Leelanau County has a larger population than Benzie County does.
So the same services
Yes,
across the 2 counties?
correct. Yep.
We have more people to service.
But don't they also, Benzie is paying more in fees that, where we are covering them here, but Benzie is paying them in fees, is that correct?
Correct,
Jody?
correct.
Thank you.
Yes.
I was just wondering, you said that you received $350,000 in grants. Is that for Leelanau County or Leelanau Benzie?
That is combined, right, Michelle? Combined, so it
There's a
includes.
variety of different grants, and most of them are district-wide as opposed to county.
So it's just applied to the health department, but
Every grant is different, so usually we're writing for a very specific program to go and provide a service or a program. So, if there's something that makes more sense to do in one county versus the other, then that's what we're writing for.
One of the grants that we just wrote for
So
is.
we don't know how much of that's for Leelanau County or how much is for Benzie. It's just because it's combined.
Right, not off the top of my head. I mean, we
Right,
could
yeah.
figure out what services are being,
Okay.
yeah.
All right. And then I was wondering, okay, you talked about several different things here for children. How many children in Leelanau County are you serving right now, 0 to 5?
I don't know that number off the top of my head. I could find out for you. or-
I'd like to know that, because
Yeah.
we're talking another 25% to your budget for, I don't know how many children that aren't being served.
Mhm. So how much, the percentage of children that we're serving currently?
The
0 to
numbers.
5? 0 to
The
5.
numbers, yeah,
Okay,
0 to
the
5.
number.
I'd appreciate that.
Sure, yeah,
All right.
yeah.
And then when I just had one other question, and when you talk about the 9.9% that are not immunized, is that, and that does seem high for any population in the United States. And do you have some underlying reason why? I don't think it has anything to do with the health department, does it?
No, I don't think it has anything to do with the health department necessarily. I think it has to do with personal beliefs. And it's just a fact that some people choose not to immunize fully, either to not completely immunize or not immunize at all. And I think it's the rate varies across the nation, certainly, but I think that the reasons are similar in that there is a trend. And some call it like a generational amnesia, that people forget the vaccine preventable diseases that used to exist in our communities that no longer do, and that's because of immunizations. It's not that they just went away, it's because of the successes of our vaccines. And so, there's a lot of research going on now to dive deeper into that, like looking at the populations who choose. Are there any trends within the populations who choose not to vaccinate, and how can we work with them, or how can we work on that? Because that's a public health concern for all of us. So.
Well, one of the reasons I've asked people about that, and they say because they're taking aborted babies and using them to make the vaccines.
Oh.
That's, I mean, that's what I've heard that as a reason why they don't want to vaccinate.
Oh, that's not true.
No?
There's a lot of myths. There's a lot of myths out there. And there have been some significantly flawed information that has been made public. I think the social media, the spreading of information, all of those things contribute to those trends. There was a study that was published in a very reputable medical journal a number of years ago that stated that there was a link between autism and vaccines. And it's since been, it was a flawed study. The doctor who led the study lost his license. The study was revoked and refuted. But people remember that. And so, sometimes it's hard to battle that flow of information that happens so quickly now.
Is the measles vaccine a live virus?
Yes.
Okay. I couldn't recall which vaccines were live and which were not. Now, for my situation, when my youngest child, it was time for her to be vaccinated, I could not get her vaccinated because I had a brother who had leukemia, and his immune system was compromised. So I wonder how many children are, how many immune systems are compromised which do not allow for that child to be vaccinated out of that 9.9%. Because if you've got a cancer patient that is in treatment, that presents a real obstacle for that.
Absolutely. So medical waivers are completely different from philosophical waivers. Medical waivers are for true medical reasons, and there are true medical reasons, and those are exactly the people that we want to protect by vaccinating everybody else, because there are people who truly can't receive that vaccination.
Right. Exactly.
I think the 9.9% that's just philosophical, isn't it? So that waiver rate is
okay.
The medical waiver rate is really quite low. It's very
Oh,
low.
I don't doubt that, but I just wondered if that 9.9% included that or captured those children, or if it was.
Philosophical.
Yeah.
Okay.
Yeah.
Okay. Thanks for the
Commissioner Ansel.
I've seen in other locations where, they have had, outbreaks and, an actual public health immediate problem that they have to address. And the health departments really do have some strong tools out there for quarantining people, and, you can't go to school if you don't have vaccine. Other places have seen that with, where they actually experience an outbreak. And I'm not sure people really understand that if that happened here, that might be their kid that would be affected.
Right. Well, even in the case of chickenpox.
Exactly.
I mean, we have to do that. We do have to do that. And kids need to be, unvaccinated children need to be excluded from school for 3 weeks. So, to prevent them from being infected and to contain that infection. And yes, the health department does have the authority to do that. That's part of the education that's provided in our waiver appointments. It's really important that we want people to understand that it's, you can make whatever choice you want, but if there is an outbreak of chickenpox, this will be what happens. And so that they're fully prepared for that. And it does happen sometimes. Yeah.
Are you looking for something?
My agenda. Okay. Is there any other questions?
Just thank you.
No, thank you very much.
Thank you all. Thanks for the time. And thanks for all you do. Thanks, Peachy and Melinda.
Okay, then that brings us to approval of minutes. We have 3 here if possible.
Mr. Chairman?
Yeah.
I would move to approve the regular session meeting minutes of July 16th, 2019.
Support.
Any questions about it?
I was going to ask if we could delay. We got these tonight, and I have not reviewed them as thoroughly as I'd like to.
All of them?
I'd like to hold on.
Oh, yeah, all of them. Okay, I'll withdraw my motion.
Okay. All right, thank you for that. Then we'll move on to approval of the agenda. I do have one request in that we move number 6 up to 1A. Yes.
Move to approve the agenda as amended.
Second?
All those in favor?
Aye.
All those opposed? The motion passes 7-0. So we now have an agenda, so that brings us to public comment. Have anyone wishing to speak tonight? Seeing none, we will move on to our action items, and the first is the HVAC renovation.
Yeah, I'll go first. As you know, we've been talking about this for 3 years, and a lot of blood, sweat, and tears have gone into this. We had special meetings August 1st and August 6th. That time it became quite apparent that every commissioner wanted to do something to address the issues here. It's how do we do it? What can we afford financially? Should we borrow money? Should we not borrow money? Should we go out for bonding? How will that impact our rating, cash flow? And so I think we all agreed we just need some time to look at options. So in the last 2 weeks, a lot of effort has gone, last 3 weeks has gone into this. And I've been talking with the people from E3 and Apollo Engineering. I asked them to come up with what can we realistically do to address some major issues. There was a survey done of all the employee shares last year. I also gave the same assignment to Jerry and Gary O'Connor on what issues do they see from a technical standpoint that are really our main focus here. And the good news is the feedback from Gary and Jerry was pretty much the same as from our professionals. So let me just start off with this memo from Gary O'Connor and Jerry to me, because that kind of is the same basis, and their priorities were pretty much the same as what our professionals came up with and with all that we have talked about. And the biggest issue here right now is our heat pumps here. We have 5 or 6 are not working. Some of them have not worked the last couple of years. Do you have? You still?
Oh, I got it.
Oh, okay, I'm sorry. I thought you were looking for it.
Yeah.
Okay, so we all agree that we need to address those, and then replace on the boiler and the baseboard heating units. That's something that we've been talking about for years. I think since the building was open, we talked about how that should have been a part of it, because that leads to other factors. And so we did that. Then I talked to our professional staff from E3 and Apollo, and they kind of came with the same list based on the many discussions we've had about this. So what you have here is a memo from me here, on this sheet here, that kind of outlines how we can accomplish these goals, stay within budget, not go out from bonding, not impact our future MERS payment, or any other projects that we may wish to take on, like the dam or some other issues. So what we did is we went back to the bidders and tried to address these issues. So let me just go over this. In terms of the baseboard heating and so forth, we did go out bid for the whole project. That was part of it. And as you know from last Tuesday's meeting, ABI was able to modify their bid just to focus on this part of the project, and that is $655,000. Shoreline Power, for the electrical part of it, was able to reduce it to $186,000, and then for the balancing, it'd be $15,000. So that's $856,000 there. Then the other part is there are some items we were going to purchase ourselves for the project. So we looked at, okay, what equipment can we purchase ourselves to get this project going? And then if you look at that, the biggest costs are the thermostats and the humidity sensors at $133,347.52, and these are exact quotes that we have received, firm bids. And then the boilers and pumps at $59,400, and then the extended warranty for the boilers, which I think all of you said was required, for $3,380. So if you have that total, that's $196,167.52. Also, for the management of that, you actually approved a proposal back in January for that based on the big project, and that was about 180-some thousand. I went back and asked them to reduce it based on this scope of the project, and they were able to reduce that to $54,000. Would you look at the scope of the project, that equates to 4.82%, which is almost identical what we did for the project next door. The industry standard is about 5 to 6% for owner's rep. And based on my projects, they've ranged, previous projects that I've done have been between 5 and 8%. So the 4.82 is in line. And then when you have these type of projects, you always find something that you just don't anticipate, especially when you start looking at that. So we put in this number of $15,000. There's no rhyme or reason how that could be spent, but I just want to protect ourselves. I know Mr. Ansorg is always looking out for every penny, so we want to be protecting ourselves to make sure that if we get in this project, we find something that no one has thought about, because when we start retrofitting a building, sometimes you find things you don't know about. So we put in there $15,000. Hopefully we won't have to spend that, but that equates to 1.34% of the project. So if you look at that total, we came up to $1,121,167.52. And a part of that project, but a separate component, is the heat pumps here. And we all agreed we need to fix the ones that are currently not working. And then we found out actually we shouldn't fix them because they're outdated. We should get new pumps that can be blended into our system. And so I asked D&W to give me a quote. And right now we have 6 of them, but I want to base it on 10 because we know we have to fix 6 of them. But next month another one could go out. Maybe they won't. But to protect ourselves and realistically have a firm budget that we can work with, I based this on 10 heat pumps. So that'd be $80,500. So if you look at the total, if you add this whole project together, this part of the project, that will really address the main issues of this building. And we can do this without bonding. Jen is here, she can talk about the financing, and you have suggested motions on where this money is going to come from. But both Jen, John, Michelle, and I feel we can do this project for the $1.2 million and not impacting our future projects such as MERS or the dam or anything else we want to do. And we can do it and address the needs of this building and make this a comfortable building. And then we can look at long-term for other updates as we go forward. But in quick summary, we think we can address the major needs of this building for $1.2 million without going out for bonding. Mr. Red.
So the priority projects, 1, 2, and 3, the defective heat pump replacement, the replacement of the boiler, installation of a baseboard heating system, those are all included in this quote. What about the humidification?
Oh, that's a part of it, and maybe Gary or John, you want to address that?
The humidification, is that included in this?
No, it's not. I mean, if it has to be updated or fixed, I think that'll be some separate.
Yeah, could you come up so I can hear you? Gary, too. But I think some equipment we're buying, as I understand, are in anticipation that we will be doing this work. Like the thermometers, they have humidity sensors.
I'll pull this out. Okay. Good evening. We shouldn't get so much feedback here.
Commissioner Rettenbach, is it humidification or dehumidification?
Well, the way it's listed here is humidification of the entire building, so.
Yeah,
I
the
don't
two
know.
are different. I mean, in the summer we have dehumidifying.
I understand that, but.
I guess
Okay.
air quality.
That is an item that we do not have in this building, is humidification. Each heat pump was equipped with dehumidification, and you'll find that most of the time it worked very well, because what happens is it just simply locks itself on and the rooms become very cold. But as far as humidification, no, we do not have that in this building.
But that's something that we have on the project list that would be primarily then used in the winter, or to
Most of the time,
humidify?
yeah, fall to early spring.
As we talked about, if you look at the big picture, about 3.6, if we could break it down into small chunks, do it over a couple of years, we actually would save that amount that we would have to spend on the bonding and the fees and so forth, and address these one issue at a time. But if you look at the big things, it's the heat pumps and the baseboard heating.
Yes.
I think there's no disagreement about that. I think everyone agrees with that. And we have a plan to address that. And we're looking long-term for a solution to all these issues. There's some other things that we could have added to this list here. But just to get us started, if we could address the heat pumps and the baseboard heating, that would go a long, long ways.
Yes, it would.
And we all agree that'd be money well spent.
Commissioner Ansari.
We have 6 heat pumps that are currently not working. And then I looked at your little highlighted item here, and it looks like we have 9 that are a cause for concern.
When I say
And we're only putting in for 4 more.
Only
So,
because
you know,
of
I'm
the
concerned,
severity of
are we, you know,
problems.
are we shortchanging ourselves, saying we're only gonna do 10, when we could have
Well,
15?
Well, I put
Just-
10
yes.
to get us through this phase of this project.
Okay.
Yes.
Because that's where I came with number 10. These, some that are, as Gary says, points of concerns, he's dealing with them. They could last 2 years, they could last 2 weeks.
The reason I put those up as a cautionary measure is simply the fact of the repeatability of breakdowns. Fortunately, they've been minor enough to be able to overcome them. The ones that are defective now, the components that are actually defective are a Herculean task to repair. Yeah, hope that answered your question.
So back to your question, maybe in 6 months from now, we may have to come back and ask you for more.
Right.
But to address what I thought legitimately we can do
Yes.
now and be prepared, I hate to come back, let's say we do 6 right now, I don't want to come back next month and ask for 1 more, and then come back in October and ask for 2 more. If we go with 10, at least I think we can get us through this year.
That'd be correct.
Commissioner Solicitor.
I was just curious, of the number is it 94 heat pumps?
95.
95 in this building. Do you have a sense of how many you have repaired, not replaced, but repaired thus far?
To give you
Just an estimate.
okay, well, going back on the last 13 years, quite a few. I hate to even begin to give you an inaccurate number. There's been several of them that have been multiple times. That's why I'm a little dismayed at this.
I can share one with you guys,
Okay.
based upon the maintenance records that we went through.
Yeah, do you want up here?
I don't have it with me, but I
Oh.
can email it to you.
Is it something that you do want to know?
Yeah, I would.
Okay, we'll
Thanks.
get that back to you.
Thanks.
Commissioner Lauder.
Thank you. So if we continue on with the heat pump system and buy new, they're available today, are they going to continue to be available 5 years, 10 years? Are there enough systems like this out there looking for new heat pumps?
There is, but what we're finding is, as time goes on, things, controls, components change all the time. The refrigerants are changing now because of EPA regulations, and this is one of the many issues that we're running into even as a mechanical contracting company. The very refrigerant we have in these heat pumps now, of course, have been basically obsoleted, outlawed now, and whatever in the world supply, that's the end of it. So that's why we transition over to the new refrigerants, and then there's rumor that that is on its way out too. I hate to be the Mr. Doom and Gloom, but these are the reports that we're given all the time.
You have other questions? Commissioner Ansori.
Go ahead, because I think I do, but go ahead, wait.
Do we have a timeline with this new suggested
Well,
option?
if you choose to start the project tonight, we'll order the parts tomorrow for the equipment as well as the heat pumps. In terms of the contractors, they are ready to start here. I don't want to, John, is that correct? I mean, you've been in dialogue with them.
Yes, Kirsten can address the timeline.
I can address the timeline, because there was just one quick modification to it. We could look at doing a kickoff meeting next week or the following week, and then prepare a timeline at that point. But the idea here is to be done certainly substantially complete before Christmas.
Okay.
And then punch list and testing and balancing in January. So,
It'll be running during the heating season, shall we say?
yeah.
Yes. Yay.
Commissioner Lauder, do you have another question?
No, I guess we're kind of taking a chance on saying, okay, we're going to stick with the heat pump system and hopefully we'll just continue to replace new pumps as we go. But are we kicking the can down the road? In a nutshell, are we just kicking it down the road, and are we going to spend more in the future?
There will be costs, of course, for repairs in the future because you still have the same vintage of equipment here. I'm not advocating replacing every single one of them, of course not. But our concerns that we were bringing up is the critical ones now, we have to do something about it before the weather starts taking an adverse turn for the worst. And that's why the 6 of them here are of a major concern.
Commissioner Lockhart, does that answer your question?
Not totally.
Okay.
Yeah, in a roundabout
Maybe I can
way.
add a little something to it. Certainly whatever we're gonna do with this initial phase will be to allow for future phases. So if you don't wanna do water source heat pumps in a year or 2 years or 5 years, you will be able to make a swap out then.
If they're available.
Yeah.
Yep, okay.
You're gonna have a cooling tower that's probably gonna last maybe that much longer, and then you'll have to address that. Which means that it would be a perfect time to change from water source heat pump to something else. But I'm just making a suggestion.
So definitely we're going to have to, we should have one line item specifically for the system in our budgets in the future to address as we go, because eventually all of them are going to have to be replaced, and the ones that are there are going to have to be worked on. So,
And maybe Jen can address the finances, but when we talked last time, I think Commissioner Ansorg asked a question. We took the original project was 3.6 million divided over how many years, how much we could spend per year on this project, and we're comfortable that if we do it section by section, we can do it without borrowing, bonding, or
no, but we are
impacting
going to
our
have the
program.
budget. We are going to have the
Yeah, we have
budget.
to do that.
It's not going to take care of our problem.
It may be helpful before we start voting, Jen, if you could explain the financing part of it and how we could come up with this 1.2 million.
She has some amendments for us that's interesting. So.
And I mean, we've been meeting on this on a regular basis, late as this afternoon at 4:30 about the financing. And I think Jen has a great grasp of this.
Okay, so what we've done is, for the budget for this 2019 project, I've taken it into two separate projects. You have your HVAC 2019 Phase 1, which is the initial setup basically that they're proposing to you to get yourself started and to get yourself moving. So what we've taken is the numbers that Chet has proposed to you, which is your 1.121 167.52, and then I've taken also into consideration the $86,000 contract that you did to get this engineering project going, and I've made that a budget in the capital improvements fund. Then on the heat pump replacements, Michelle and I had discussed this beforehand, that we really feel that that is more of a repair and maintenance, but it is an improvement to your location here. So we wanted to see that separate, in hopes that the 8,000 maybe is the higher end of what the heat pump is actually going to cost, and maybe it'll be less than that. So like Chet was asking or stating, basically it's 6 for sure. We put in 10. I multiply that by the rate of 8, and I'm going to get 80,500. That number I am specifically taking from the general fund. And a couple of years ago, before the Leland property sold, we had discussed, worried about the capital improvements fund having money, and we were budgeting 100,000 each year to fulfill that side. So we're actually less than if we had put it in last year's budget. You know, that 100,000, it's really actually going to be 80. And we're in hopes that that will get us farther along, maybe even if there is more than 10. If it's less than the 8, you'll get maybe 1 or 2 more pumps out of that budget, okay? Whatever's not spent for that heat pump budget for 19, I will most likely, since the money's been transferred, go ahead and make a project or put that in repair and maintenance for 2020, okay? So your allocation will stay that same. That amount will still keep going until if Chet needs to come back to you in reference to more heat pumps or a different situation. When it comes to the actual HVAC system, it was talked about prior, what we could fund now. So the budget amendments and the fund transfers that you'll see at the end of the meeting in regards to this is going to be a general fund transfer in of approximately $641,000, and then a DTR transfer of $870. Now the $870 is actually including in what we call the slight shortfall with your LEC roof. We were about 310 short. We were budgeting 900 some, came in at 1.2.
So that gives us the 1,511. Together? Is that what you did? You took your 641 and your...
Yes,
Okay.
1,511, 688, yes.
Okay.
So
And
the,
your 870, okay.
Yep, so the 870 from DTR comes into the capital improvements fund, and then the general fund is 641,
Okay.
which is 1.511668 to cover your expenses for the projects. And originally when we had talked 750 from each fund. So it's a little bit different.
So what's 007 going to do for us?
Amendment 0007?
Yep, because you got HVAC on that one too.
Yep, so the amendment is gonna be to DTR is gonna be a little bit different because he had a contingency in his budget. So he had an unspent line item of 358. So I didn't have to pull, I pulled the cash, but I didn't have to pull from his budget. That was unallocated at the time when we did our budget in last year for this year.
Okay. It's fancy footwork.
You betcha.
Any other questions for her?
It just,
Commissioner Sudislaw?
as I'm looking at your email, Gary and Jerry's, when you're looking across your cautionary and your they've gone out pumps, where you're identifying, there's certainly across the floor is a relationship on where those seem to be. So I'm wondering, since they were all put in at the same time, and you say a number of them have been repaired maybe once or twice, is there more demand being placed? Is some cycling a lot faster or harder than
Yes.
others? Okay.
Yeah, especially
so
in
you
the,
can use it as a
the-
bit of a predictive tool. Perhaps.
And I've taken that into consideration too. The most used areas, in general terms, have more of a demand on that comfort control. So that makes a lot more sense. But I'm starting to also see that the courtrooms, A and B, they're parallel heat pumps. And I'm starting to see, and that's on a cautionary note on there as well, they're starting to act up. Without going into too much more detail about that, but I'm starting to see repetitive problems there, and that's why I'm kind of quite concerned, especially there, let alone the clerk's office.
Yeah, the clerk's office is the most trafficked area in the building.
Yes.
And that's the heat pump that fails the most.
For the record, that'll be the first one changed, the clerk's office. Gotta keep those people happy.
So do we want to move forward on the HVAC project? Go ahead, Commissioner Wessel.
I haven't prepared the motion, but I'd like to move that we move forward on the plan as proposed for a total of $1,201,667.52 as presented, funds coming from the transfers and general fund as described by our accounting department.
Yeah, we do have motion already written out. If you look on page 2 of the sheet here.
We have quite a few motions for you to consider.
Yeah, and so we.
I apologize.
Yeah.
Well, we want to make sure that you fully understood, and that's why that'll help her, Jen explain it, but everything she said is listed in the motion, in specific motions.
So if you start at page 2, and I would like, if you want to make that motion that's in the middle of page 2, I would also ask that you rescind the $3,685,868 motion, or reduce it to this amount, the $1 million.
Maybe we should do this one first. Rescind that motion.
Or would you rather do that? Yes.
I would rather rescind it, get a clean board, and then start with what we want to do today.
All right.
If you don't mind.
No, I don't mind. Either way works. So the amount that we're talking about is that we do have on for not to exceed is $3,685,068. So I would look for a motion to rescind that motion. Commissioner Answer.
I so move that motion with that amount.
And
Second.
okay, and this will take a 2/3 vote because it's gone past the 1 month, and this is the same. Commissioner Lauder.
Actually, you passed that August 1st.
Was it?
Yes.
Are we within our policy range then, or do we have to vote to consider the rescinding
Well,
first?
depends how you look at it.
Okay,
I don't have the board minutes, but it has not been a month because you've had a special
Yeah,
meeting.
it was
August
August
1st.
all right.
So I believe it
Okay.
says,
It is
So we
August
can
1st.
rescind it because
Right.
it's
So
within
I
the
believe
time
within
frame.
a
Okay.
month.
Yes.
All right.
So then it just takes a regular majority. So everyone knows we're voting on eliminating the $3,685,068. All those in favor?
Aye.
All those opposed? The motion passes 7-0. Thank you for doing that. Now, if we go to page 2, we can just do these clean. Go ahead, Commissioner Wessel.
I move that the Leelanau County Board of Commissioners approve the revised HVAC project for the Leelanau County Government Center in an amount not to exceed $1,121,168 with funding as follows. Transfer of $560,000 from the Delinquent Tax Revolving Fund number 516 to the Capital Projects Building Fund number 470. And transfer of $561,168 from the General Fund 101 to the Capital Projects Building Fund number 470.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner Wessel?
there's quite a few more
Did
motions.
you want to, we have to write down the line. If you would, this
I
all
could,
has.
I could share the wealth here. I move that the Leelanau County Board of Commissioners approve the fund transfer of $80,500 from the General Fund number 101 to the Capital Projects Building Fund number 470 to cover the anticipated cost of equipment and labor for 10 heat pumps.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Thank you.
Do you want me to take over here? I move that the Leelanau County Board of Commissioners approve a fund transfer of $310,000 from DTR Fund 516 to the Capital Projects Building Fund number 470 to cover the balance remaining for the repair of the LEC roof.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0.
I move that the Leelanau County Board of Commissioners approve the agreement between the County of Leelanau and ABI Mechanical in an amount not to exceed $655,000 as presented, funds to come from Capital Projects Building Fund number 470.
Second.
And this is for the contract as well, so that we're approving the contract with this motion. All those in favor?
Aye.
All those opposed? Motion passes 7-0.
Somebody else want to take over? I'll move that the Leelanau County Board of Commissioners approve the agreement between the County of Leelanau and Shoreline Power Services, Inc. in an amount not to exceed $186,000 as presented. Funds to come from Capital Projects Building Fund 470.
Support.
Again, this is for the contract with them. All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner Long.
I would move that the Leelanau County Board of Commissioners approve an agreement between the County of Leelanau and Integrity Test and Balance Incorporated in an amount not to exceed $15,000 as presented. Funds to come from Capital Projects Building Fund 470.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner Lautner.
I would move that the Leelanau County Board of Commissioners approve the issuance of purchase orders from Leelanau County for major equipment elements as outlined. Advanced Building Control Systems, $133,347.52 as per quote, number 143, dated August 8, 2019. Aetna Supply, $59,440 as per quote, number S103151020, dated August 14, 2019, and AIG, $3,380 as per quote, S103151020, dated August 14, 2019, funds to come from Capital Projects Building Fund 470.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner West.
I move that the Leelanau County Board of Commissioners approve the purchase of 10 heat pumps from D&W Mechanical, which includes a 6-year warranty from the manufacturer at an estimated cost for labor and materials of $8,050 per heat pump. Funds to come from capital projects building fund number 470.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner Rush.
I would move that the Leelanau County Board of Commissioners approve a contingency of $15,000 for the revised HVAC project, and those funds to come from the capital projects building fund number 470.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner Redmond.
I move that the Leelanau County Board of Commissioners approve a contract between Leelanau County and
E3.
E3
Yes.
as the owner representative and professional fees for the Government Center HVAC contract in an amount not to exceed $54,000, funds to come from Capital Projects Building Fund 470.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Thank you all very much. Commissioner Wesson.
I know we've been frustrated by this, and we've frustrated staff, I'm sure, but I'm pleased with this solution, and I commend Jen and the accounting and the treasurer and the administrator and the experts. Thank you.
Thank you.
Thank you very much. So that concludes the HVAC project. Thank you.
Thank you.
Yeah,
Thank you.
Can we
thanks.
take 2 minutes?
Yes, I will take a 5-minute break.
Actually, this only starts the HVAC project.
Well, I
I know.
I
It's
wouldn't
gonna
start
start
yet.
yet. I know, I know.
Okay, I'd like to call this meeting back to order, please. So that concludes 1, so now we're up to 1A.
And as they're coming up here, I passed out this morning the legal opinion from January 23rd, 2004. And Mr. Christensen and I had a talk with the attorney that wrote this 2 weeks ago, and they confirmed that all the provisions are still accurate. So I thought you should have a copy of that.
I appreciate that. Do you have this?
Yes. No, it's the opinion. This is the opinion. Yeah. Okay. Court opinion.
That's only information, it's really not part.
So this is for the engineering study and a recommendation that we do that.
All right, I'm going to clear off some of this
And
paper.
there were some questions concerning the amount and what it includes, you know, at our meeting for the 19,000. And so Mr. Machin is here for any other questions that were concerning that. So just maybe give us they talked about you taking pictures for $3,000. And so
Okay.
people were a little nervous about that.
Okay. So, in essence, the main portion that is proposed inside of this is a lockout system that would help prevent the dam, the gate, from operating without basically a device that would prevent it from rotating if there was a loss in hydraulic pressure, if there was a loss in the connection. These gates, or this gate, is operated by hydraulic rams. And so currently right now there is no lockout, kind of like best way to say it is like a boat winch. You have your boat on a trailer and it sits there just fine. But if it starts to head downhill, the winch needs to have a device that locks it to keep it from going backwards and falling off the trailer. This is very similar to this. This is the idea. In order to do that, we have to actually take a 3D scanner inside of the building that takes pictures But also what it does is it takes data. It'll take millions of data points in there, and then what we can do is we can actually take this model of this room three-dimensionally into the computer, and then we can take accurate measurements that would allow us to determine a mechanical fit onto the existing operation without basically having to take it apart and take those parts and pieces and take them to a mill shop basically and match something to it. We can actually then design in the computer a device that would fit right onto the existing operation of the dam. So right now, if you will, there are two large plates basically that are at the end of the rams that come down, and as those rams operate, they move and pivot that plate, which then is attached to a pivot pin, and we would basically attach that pivot pin, but in order to do that, we have to actually take pictures and put a laser scanner inside of there basically and almost just set it up, and then the operator just leaves the room, and that device then takes all the pictures and goes through its whole operation. And we do lots of setups in here, so we have a lot of overlap. We've completed this on other projects, and we've had very good accuracy with doing that. And what that does is it prevents, again, taking parts and pieces off of the dam, taking them to a mill shop, having people match that, or taking a bunch of measurements and then having an issue with inaccuracy during construction, which could lead to cost overruns, which can basically lead to, okay, I have to redo all this whole part and piece or whatever that happens to be because we had inaccurate measurements, because a human being can only do so much.
And to continue the purpose of the lockout system, refresh our
Sure.
conscious awareness of all of these dam parts.
I wish I had something to draw with. I'm going to draw a picture and then I'm going to explain it.
Don't we have a whiteboard for that?
Pardon me? Well, it's not hooked up to,
Okay.
Yeah, but
I can draw it up
that.
and then I can explain it.
Huh.
are those markers
Can I
there?
draw in there?
Or are those the right markers?
Should those markers, they should.
Because somebody used the wrong markers one time.
Here we go.
I can turn this.
Here's our area.
That's why we put it there.
Make it big enough, Pat.
These electronic.
Yes.
But you can use them.
This is the 21st century. We're talking about 3D laser scanning. I don't know how.
Oh, let's make sure that.
As long as it's erased.
Is it an erasable one?
Yep.
Okay. This is just a various picture here, but we have basically these plates that come down here and they're operated, and then they rotate on the end. So this is a ram that goes up and down that operates and causes this pin to rotate. If we lose hydraulic pressure here, it happens is that gate actually gets slammed down, and if there's an operator in the gate bay, the operator can be injured because that gate comes down and there's lost pressure, and that can be an operator. Because basically you have all this out in the gate bay itself, you have the water that's cresting and coming over, and there's all this pressure. This is tied right to this, and if this allows to rotate, and there's an individual down there, there's nothing here to prevent that from occurring. So what we would do is we would basically come in here and we would measure all of this apparatus, and then we would tie something on the end of this pin, if you will. Let's just say that there's put a gear system in here, and then we put like a cam lock or something like that. It just basically prevents it. It has one-way operation, and then the operator basically can engage this, so if this thing decides to move any further, if there's somebody out in the dam, this would prevent that from happening. It's a lockout mechanism. There's many different ways to go about this, but one of the things that we had thought about was creating a device that sits on the end of this. This is where the time-consuming part of this. The device would actually then also be a manual operation. So if we happen to lose hydraulic pressure here, we still need to be able to operate the dam. We have a method for coming in here, basically like a valve. We can crank the wheel, and then we can operate the dam by hand, the old-fashioned way.
But I think we're getting off, because we're really talking about the water that's coming in That's what really was part of it. So, but part of this study is for this lockout?
I'm saying that this is, yeah,
This
there's
is
a
the
lot of
camera.
fee that's involved here, and I just wanted to kind of give just a general education.
What maybe help for the commissioners, if you could just review your two proposals. One
Sure.
was for the, as I remember from the dam authority meeting, one was to address the issues of the water flowing in. The other one was to address the OSHA concerns and the safety issues.
I would think that that would be an OSHA concern right there.
Yeah.
This is one of the OSHA concerns.
Okay.
So there was a question with fees, and that's where I was getting into.
Yeah,
There's-
if I could just interject.
Sure.
The engineering that we're requesting covers all of the aspects. Once they get into the engineering parts of it, it's important for them to do the whole thing, because it's hard to cut it into real fine pieces. So they'll get in and do the engineering, and then we have that portion done for whatever it is in those two pieces. So that'll be done. And the engineering part can get charged back to the special assessment district, either in its entirety or close to or whatever. So there is that aspect of the engineering portion of it. And that's what we want to get done so we can get the ball rolling.
May I ask one quick question,
Go ahead.
Mr. Chairman? How is it that we didn't have a lockout mechanism built into this dam when we built the dam?
The concept of holding the dam up would be achieved by manufacturing posts, if you will, that would lock into the plate and lock into the dam itself. They were not made. The concept was available. The dam itself is a fail-safe. There are 2 pumps and there are 2 rams. And 1 pump and 1 ram can hold it up. So there are fail-safe parts to it going in to actually work on the dam. You have to dewater in front of it to get the water pressure off, and then you could work on the dam, like do seals or do replacements of different kinds of parts. What we're looking at right now is a mechanism that can be installed where we can lock the dam in position and do a replacement without dewatering, without getting in front of the dam and putting a post in. Something that we didn't think of or go through the process of when we initially did the dam. So we're at a point now where we're going, is there a way to do this that is safe, more efficient, cheaper, and can we get this done in this fashion that we have in front of you tonight? The safety is kind of like putting the car in park. The mechanisms that they're going to do achieve the same thing as putting your car in an automatic transmission in park. So that's kind of where we're heading with this, and I think it's the most cost-effective way to get where we need to go, and now we've got the flooding on top of it.
So Patrick, your proposal was for $19,860. What does that include?
So that includes, I'll just point to it because it's easy, that's the mechanical interlock system. Also, too, one of the things that is an OSHA safety concern, and it is required, is remote greasing of the gate. And that remote greasing can be completed so that it's basically at access inside the control room. This is a common thing for dams with rotating parts, and it can be completed so that the operator doesn't have to go out onto the dam to do that. And then, of course, then the other portion is this emergency part, which would include basically coming up with basically a bulkhead or something like that that prevents the water, once it rises, prevents the water from actually getting into the room, and then some other pump out system that water does get in the room, because there is electrical components inside of the room, that we can evacuate the water without having to put the operator into harm's way for operating equipment.
Commissioner Ansari.
We're gonna create a computer model of that control room. So we will, if we need to do any future work, you already have that model, and we could, you know, streamline the process. If we have an emergency in the future, you already have that model in the computer, and the county owns that model?
We would provide that to the county.
That's not what I asked. Does the county own the computer model?
I would say no, and the reason being is because we're always cautious on what we give someone ownership to. And the reason why I say that is because it's only at the discretion of how you use it. So you could say that we have it, but what are you going to do with it, really? I mean, it has access to it that anybody who else has access to that type of data. You have to have you can get the software for it and have open rights to it. That's, for instance, like an AutoCAD drawing, for instance. You can have the rights to it, but the ownership comes from the company that always procures that information. And I always say that's just at the discretion, basically.
That's a problem for me, because we have run into that issue in the BPW in Elmwood Township as part of Grand Traverse County, and that was a huge problem because when they switched engineering firms, they didn't own the model. And it went downhill fast, and it cost a lot of money. And I'm talking about the septic treatment plant fiasco when that happened. So that's a problem for me. You know, my assumption is any drawings, any computer models that the county pays for, we should own. That's my opinion. Just based on the history of what happened in Elmwood Township.
Well, I think we had the same thing here with the monument. We had a drawing of the monument that the architects did, and then we switched it from one side of the road to the other, and we didn't own that drawing. And so they
paid for it.
Right, but we had paid for it. So I do understand what you're saying.
How can we resolve this between you and the county board? How can we resolve this issue?
So I guess I wanted to preface ownership and having usage of it are two different things. That as a design professional, we always own the products that we produce. We always have the right to those. You can have copies of those things. And copies, when I say copies, you would have a copy of the three-dimensional information that's involved.
So if it's in AutoCAD, we have a copy of that file.
I already told the dam authority that we would provide the copy of that information, because I think that is reasonable to provide. I just try to make it a clear distinction between ownership and use.
Do we have a county policy on things that we pay for, whether we own them or not?
I don't think of a policy, but I think because of that incident several years ago, I believe our legal counsel and all of the contracts say that we have, I can't think that, it's not ownership, but something like what you were mentioning, we would have access or copies or.
Exclusive rights.
Yeah, there's a clause in there that we put in there.
And the use of.
Yeah, to protect from that situation. We have put that in all the contracts since that incident.
So I'll just make a clarification. What happens with design professionals is that we hand over documents that we've designed, then somebody can make changes to that and then send those out and under the representation that it came from the firm that provided that. Mm-hmm. That is against my license. The state of Michigan says I have to maintain ownership of things that I have represented as a design and have a promise to the health, safety, and welfare of the public. I can't provide those and give those ownership to people because then they can take that information and say, here you go. Machine didn't come from Machine, but there could have been changes to that because in the digital world, you can quickly make a change that misrepresents the design. So we say you have use of it and you have the copy, but you don't necessarily have ownership because that's against my license.
If you choose to proceed this in a contract form, I'm sure our legal counsel would incorporate that in the terms that both sides would agree to.
And I'll give you this just one other example. For instance, when we do work for Consumers Electric, Consumers Power, we provide them design, we also provide them a digital copy of the drawings. And it's on their title block, and they have use of that. That was a requirement. But when it comes to digital signed documents, we have to be very careful what we hand over, because we can't have it misrepresent what we provided to the owner. That was all.
I understand all that. I just don't want to get into the situation where we paid for something and, oh, we don't have a copy of it, and oh, I can't find, you know, the engineering firm couldn't find a copy anymore because they weren't involved anymore. Well, I'm sorry. We should have a copy in our possession. My 2 cents.
Commissioner
But
Sotis.
aren't you referring to a digital copy?
I'm referring to a digital copy.
Right. Okay. So, in that case,
As long as we have a copy
We would have
that
it.
we,
Commissioner Rush.
I can understand your position. The copy and the use of the copy for this board, let's say we get a different engineer in the future. That copy, I would think, would be presented to a new engineer if we wanted to make any sort of changes or whatever. Can that new designer, engineer, whatever engineer, can he take your drawing and draw from that design?
Change it you're talking about?
Use it for
Can he use it? Can he alter it and use it?
a second laptop system, I don't know, whatever.
I have to be honest with you, I don't get asked this question more than once in my career. And I'm trying to formulate a response that is responsive to what your needs are and also meets the requirements of what my license as an engineer. So,
I think Chet was hitting on the key and solution to the discussion. I think the legal eagles have been bumping against the digital world again and again and again on a daily basis. And I have a real strong hunch that there's a standard contract that covers exactly what we're talking about. I don't think we have to invent it. I think it's already exists.
I think
We could
will.
say, with the council's approval, to satisfy this question or something like
Well,
that.
for example, if you look at this project, this building, we were able to provide Apollo Engineering all of the drawings, all the schematics, everything from when this building was built. They used that, they didn't copy it, they put their own stamp on it, they redid it, but they used that as a source, so they didn't have to start from the beginning. With the roof project, Jerry provided them the original schematics for that project. They used that, so they didn't have to start from scratch, because that would cost a lot more.
Well, that's the
So
point.
I think that's what you're.
that's what I'm getting.
Well, we did have a case several years ago, I forgot what it was, that we didn't have a copy of something. And I believe it was next door and the company's gone out of business. We had no access to it because no one provides a copy.
Right.
For example, with the HVAC next door, when they complete a project, we have a complete manual, hard copy, plus we also have a digital copy of everything that was done next door. And I'm sure with this project, once we get this done, we'll have that also. So I think we can get beyond that.
As long as we have a copy and we're able to use it going forward.
Well, I did have a question though, where this is a $48,000 project and 40% of it is the engineering. I mean, I'm not sure why 40% of a project should be engineering. And then the next project, then there's another $4,000, which, yeah, for engineering as well. So it just seems excessive that when it becomes 40% of the project. Is that, I guess that's my question.
Well, like I said before, the engineering is for the whole thing. If you combine both projects together and you have a total of 109,000, the engineering is 19,800. If we were to decide to do
It says
every.
there's another 4,000 on the other part.
Correct, because we're splitting it in two. We're doing the emergency part right now, and we're doing the other part after the special assessment district is generated and going. feeling that we need to have the water away from Jerry's door when the weather turns so he can get into the control room. If we could possibly turn and just do the emergency part so Jerry can get into his control room when the weather freezes and the water's not there, because we have done the emergency work, that would be important, I think. That's why we're kind of splitting this in two. If we had the luxury of doing the whole thing next spring, or whenever we get the special assessment district going again, I think we could just wait. But part of this is the flooding. There's the emergency part. It's the knee wall and the sump pump. The engineering is for the whole thing altogether, because they can't really do just a little bit of that engineering. They've got to get in there and do their digital formatting. They've got to get it on CAD. They've got to be able to do all of that.
So is the engineering 19,800 or is it 23,800?
If you split it into two projects, there's two timelines of administering the project, and that's what that is. There's not another engineering proposal involved with this, because at the kind of what was requested was the emergency portion be split out with whatever with the remaining, the whole project. So we kept the engineering for the whole thing on the emergency basis so we can engineer everything. But then because of that split, there's going to be additional time that's going to be needed to oversee the work for the greasing system for this installation of this interlock system at a later date.
So it's 23.
Right.
So that's the memo or the email that you sent with additional approximately $4,000.
And that's just an estimate right now as part of the estimate. It's not a guaranteed sum.
Okay, so we're going to do a $48,000 project, and we're going to have $24,000 in engineering?
Which will cover.
And that
planning
engineering
data.
will cover the
Second.
second portion also.
Yeah, so that's already done. All the x-rays and all that stuff will be done up front, so we have it for phase 2. Okay, that's for the cost.
So I have a simple question. Simple pin won't do, let me go back out to the lockout system, you know, like, because when I'm transporting a disc, I raise it up and put a pin in, and then drop the cylinder back down in the pin so that it's not rusting, you know, on the hydraulics, on the cylinder going down the road. That pin keeps that disc from going any lower. We can't do that with a simple pin, won't hold it?
In other words, raise it up and then pin the sides similar to.
Or you don't know, or is that what you're going to figure out how to do?
Well, that's part of what we have to figure out what to do. It's a complicated process. It requires us to model the system, basically, in order to make sure that once it's all said and done, that it's actually going to work.
All right, I'll look forward to that. Right now, we have to worry about the dam, the water.
What's your answer?
Let me put it in how I understand it to be. We're paying for some engineering work now that will address the emergency work that we need to do, but also will be used down the road for ocean work that we know that needs to be done. And from my understanding, the design is not just a simple lockout, but they're also looking at a mechanism to manually operate the dam, as well as an automatic grease system, so that the operator doesn't have to go out there to get those grease fittings.
And who knows what else?
Well, and we don't know.
Right.
And that will be all that other stuff will be part of what comes when we have to go forward with the special assessment district, how much money we need for all of that other stuff that we don't even know about today until we get into it.
The engineering portion is part that can be charged back
And that,
to the special assessment district.
So the motion is on page 7. It's the second one down.
But you probably want to change that because it's no longer a quote, or we'll have to draft an agreement, right?
We would have to get a contract.
Yes. So I would not suggest
pending corporate counsel approval, all that kind of stuff.
Commissioner Lawton.
Don't we have a contract in place?
A general one just for their fees, not for this project.
General contract, okay. All right.
You know, we went out for engineering services several years ago, and Patrick and his company were successful. So we have that, but this is for a
Okay.
special project that would cover this project.
And we had an amendment that addressed the initial OSHA review. So we would probably have a second amendment
Regarding, I'd like to say something regarding the engineering part of this. Pat is not going to do something unless he knows the integrity of the dam, where he's satisfied. Okay, that's what a lot of this engineering, X-ray, and different things. I'd want to know what I'm setting up, what I'm hooking up to, what I'm using as a foundation, verify that he's satisfied that that's there, what's on the actual as-bills. But that covers him as a professional to make sure that he's got, you know, a lot of liability here. You just can't throw a sandbag in there and without knowing what's going on. So that's, you got to know what you are going to tie into, and that is, it's good business and good practice.
Commissioner West.
Do we know where the funds are coming from? I see the motion, I'm prepared to make it, but it says to be determined. Is that?
Where are we gonna get the money?
Where would you like to take the money from?
Will's budget.
This has to be from general fund, won't it?
Yes.
Come out of
General fund.
contingency, yeah.
Have a motion?
Yeah.
I move that the Board of Commissioners waive the board policy on bid requirements and request for proposals and approve the quote from Mackin Engineering for the engineering portion of the quote in an amount not to exceed $19,860. Funds to come from general fund pending corporate review.
Second part.
Commissioner Lautner, did you have?
Do we feel like that is complete enough to move forward? If we're going to just add for corporate review, does that do what we want it to do now to get moving?
Well, we'll have corporate do the contract. If you approve this, we're going to assume that you're given the permission to come up with the contract and for the chairman to sign it pending corporate review to start the process.
Okay.
And I guess my question is, do we have to do the other 4,000 later then? Or does that have to be done tonight as well?
You do it later, as far as we're concerned.
All right, so this is yeah, at least to get the initial work done. All those in favor?
Aye.
All those opposed? Aye. So the motion passes 6-1.
Patrick, you may have mentioned this, but how much time would this take, this study? The engineering study?
We would go through and complete the emergency portion first and release that as a first release of the project, just because the other portion is going to take much longer. It's probably going to take 60 to 90 days to vet out the project. So the emergency portion would be able to be done much faster than that.
So approximately how long?
I would say 3 weeks.
And then you have to go out for bids.
Correct.
And how long will that take to go out for bids? Let's try and get a frame here.
You're probably looking at a couple of weeks, to be honest with that. And we'll work on our best to get this out sooner, knowing that it's an emergency portion. Condense that.
So we're probably looking at the first part of October. For the earliest work would begin would be in October.
Probably the middle.
Yeah, but the very earliest would be, yeah.
What about availability of contractors?
Well, yeah, that's all. We'll know until we bid the project out. But the best case scenario would be for you to come back to the board with a recommendation for a contractor at the October meeting.
Right, and the
Which is the first part
contractor,
of October.
Yeah.
this contractor would just be basically in charge of concrete. There would be some plumbing that would be involved and some minor electrical work.
logistics, the deck, getting to it.
Schedule look like?
So,
I have a question on that though.
Yes.
I thought we didn't want to go forward with the work until we get.
We'll have to come back.
No, but we can't charge it to the assessment district if we begin the work before.
yeah, no,
That's set up.
Correct.
Emergency's
Correct.
gotta be
The
done.
emergency
Have
work
choice.
is
There's
gonna
no
have
way
to
we can get
happen.
the special assessment in place by October.
No,
Okay.
we're not gonna have
Would you
choice.
agree, Steve?
I would agree, John, John doesn't have it like on a file. It didn't get passed into the digital world. So I've seen a box or two that has the slips. And with the townships are gonna be involved in updating that. And I don't pretend to know all the ins and outs of getting that going again, but it is gonna be a process.
So we will not only pay for the engineering, but we will pay for the emergency repairs. And if we move forward with the OSHA repairs, then that would be charged to the assessment.
There isn't the urgency with that.
Right.
But we want a plan.
Yep, we gotta have a plan.
Can't the engineering be charged back?
The engineering can, but
Yeah,
not
they're
the
gonna have to look at it.
materials.
I think we're all set then. No,
The
thank you
engineering
very much.
apparently can.
Okay. All right, so then that brings us to Leelanau County Sheriff's
May I ask
Office.
a question, Mr. Chairman?
Certainly.
Do we want to make a motion to begin the process of designing the assessment district tonight, or are we gonna wait a month?
That's already started.
Well,
I mean, the preliminary work, but they're not ready yet we don't have a proposal to you yet.
We have to lean on the legal side to make sure that we're touching the right bases to go back through and set that. I don't.
The background work is starting. At this point,
Right.
there's nothing that you would pass that would help with the process.
all right.
Would you agree, Steve?
I agree.
Other than we don't know if we're going to do it by assessment district yet. You
No,
don't know that.
yeah, you're right, that has to be, what I was telling Commissioner Bunnick last week, we may want to have a special meeting, joint meeting with the dam authority, because this is a
Okay.
critical issue that we just can't wait week after week after week. At some point, we may want to have a special meeting.
Okay.
And really
Yeah,
outline who's
that's
doing
fine.
what.
Yeah, the ins and outs of how to do that, and you guys are gonna have to hear that discussion completely through. It's gonna be one that we're gonna want to have, so I think that's a good idea, Chip.
Okay, thank you.
Thank you.
Thank you much.
Thank you very much. Any other questions? Okay, now we'll move on to the Sheriff's Office and the Animal Control Agreement.
Mr. Chair,
Commissioner Wessel.
I move that we approve the renewal of the agreement for animal control services between the County of Leelanau and the Grand Traverse Band of Ottawa and Chippewa Indians until September 30th, 2022.
Second?
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner Rushton.
Motion that the Board of Commissioners allow the Sheriff's Office to apply for the fiscal year 2020 Secondary Road Patrol and Traffic Accident Prevention Program grant in the amount of $33,065.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner Lautner.
I would move that the Leelanau County Board of Commissioners direct the Solid Waste Council to work diligently for the next 6 months to secure a site in Leland or Westlake, Leelanau for a recycling site.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner Rushton.
Motion that the Board of Commissioners approve a 2020 scrap tire recycling grant application to be submitted on behalf of Leelanau County by the due date of August 30th, 2019.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Thank you.
Can we do that? Just throw that in there like that? I'm just asking.
Why not?
Okay.
I don't know that what we threw in there, it's all in here. It's all from the,
It wasn't on the agenda, is my point.
oh, yeah. Well, we did pass it, I know, last, and so it was there.
I just, if we have to do something different, tell me what else we have to
Okay.
do.
No, we're fine.
Okay, thank you.
All right. Commissioner Ansori.
No, I'm done.
Trudy's here. Okay. Trudy, did you have anything you want to say about it?
Which item?
Well,
in general.
We're at the general plan.
Okay. I thought the question was on the tire recycling grant.
Well,
so I wasn't-
it was, because it wasn't on our agenda, and we passed it anyway.
It's on the
No,
agenda.
it's
on the
up to
agenda.
tire
Well, that's
recycling.
what you were saying, but.
No, it's Melinda's motion about.
Melinda's
Oh,
motion.
oh, the
And
recycling
I
site.
did submit to all of you a copy of the grant application with an amount. I don't know if you want the amount in there or not, but there's an amount submitted in there.
Well, your application was approved as presented, so.
Okay.
we're fine.
The general plan, what we're asking for is the release of the general plan for public comment period, which is a 40-day comment period by law because it's an amendment. Commissioner Lautner and David McCullough are both on the Planning Commission, and they were at the last meeting where the Planning Commission asked that I bring that forward to you to release it. So if you do that, then by law, the Planning Commission has to have a public hearing, which we'll do at their October meeting, and then submit to you what action they took. And at that point, you can decide to hold a public hearing yourself. You don't have to, but you can. And you can also decide if you want to take final action on the plan or leave it just with the action that the Planning Commission took. So tonight is just asking for the official release so that we can get that 42-day comment period going.
Commissioner Locke.
So I would move that the Board of Commissioners approve the release of the draft general plan for the 42-day public comment period.
Support.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Commissioner Locke.
I would move that the Board of Commissioners accept the Leelanau County 2019 through 2024 Capital Improvement Plan, the CIP.
Support.
If I may.
Yes.
Thank you for putting in the dam stuff.
The dam.
Anything else? Any other comments? All those in favor?
Aye.
All those opposed? Motion passes 7-0. That brings us to the MDHHS contract.
Which got left out.
Commissioner Wesson.
Where is it?
I move that the Board of Commissioners approve and authorize the County Board Chairman to sign the Second Amendment to the Tower Space Lease Agreement for AT&T on the Almena Tower site. Further, I move that we reset the terms of the agreement to the first year of 3 new 5-year terms.
Second.
Thank you. I was on the wrong one. Sorry.
This is what we're doing, right?
Yeah,
Okay,
we'll do
good.
this one right now and go back. So I'm gonna see if I can find it.
Any other statements or questions? Sorry I confused you. All those in favor?
Aye.
All those opposed? Motion passes 7-0. Now we're to the Motorola agreement. Commissioner Rettenbach.
My motion did not include the
Central Tower,
second-
and that's
second
the
tower.
motion I
okay.
was going to make.
Okay, go ahead.
I move that the County Board of Commissioners approve and authorize the County Board Chairman to sign the Second Amendment to the Tower Space Lease Agreement for AT&T on the Central Tower site. Further, to reset the terms of the agreement to the first year of 3 new 5-year terms.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. So now we're to Motorola.
Okay.
Go ahead.
I move
I'll
that-
get on track eventually.
I move that the Board of Commissioners accept the proposal from Motorola Solutions in an amount not to exceed $21,000 for dispatch council and recorder equipment maintenance. Money to come from Dispatch 911 Services Fund 232-000.001.000, pending county attorney approval.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. So now we're to the Commissioner Wessel.
I move that the Board of Commissioners approve amendment number 1 to the contract between Leelanau County and MDHHS, increasing the contract amount by $15,000.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. That brings us to the Crime Victim Rights Grant application. Commissioner Rittenbach.
I move that the Board of Commissioners approve the county prosecutor to renew the Victims' Rights Grant with the state of Michigan in the amount of $39,921 for the period of October 1, 2019 through September 30, 2020, and authorize the county clerk to continue as the authorized official in the e-gram system as previously agreed upon by the board.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. That brings us to the 2% allocation. Commissioner Wessel.
I move that the Board of Commissioners accept the 2% allocation awards from the Grand Traverse Band of Ottawa and Chippewa Indians as follows. Board of Commissioners, Leelanau County Cancer Foundation for $2,500, and Administration/Veterans Affairs, Mid-Michigan Honor Flight for $2,500.
Second.
I would like to have that motion split between the two.
Okay. So we're gonna, well, that's a,
I'll amend my motion to just
Well,
include the...
you don't have to, we just, if one request, then
Okay.
we just
Okay.
do them individually.
Okay.
So the first vote will be for a Mid-Michigan Honor Flight program. All those in favor?
Aye.
All those opposed? Motion passes 7-0. Then now we'll vote on the Leelanau County Cancer Foundation. All those in favor?
Aye.
All those opposed?
Aye.
Aye.
Can I have a roll call vote, please? I-
Certainly. Roll call.
I don't know who's what.
We'll find out.
So will you.
Commissioner Wessel,
Yes.
Commissioner Answergi?
Yes.
Commissioner Bunnick,
No.
Commissioner Lautner,
No?
Commissioner Rentenbach,
Yes.
Commissioner Rushton,
No.
Commissioner Sotos Little.
Yes.
It passes 4-3.
Okay, motion passed 4-3. Thank you. So then that brings us to the 2020 MAC dues.
No, the
We have
contract.
the contract.
What, oh, the
Contract.
LCC, oh, we have to have a contract? We have to approve that?
Yes, because.
Doesn't that approve when we accept it?
No, you just accepted the funds.
Okay,
It's similar to the Habitat for Humanity.
exactly. Okay, so this will be on a contract that we have to now sign with the Leelanau County Cancer Foundation for the $2,500. All those in favor?
Aye.
All those opposed?
Aye.
So the motion passes 4-3.
Who read the, oh wait, you did.
What's that?
She was asking who made the motion.
Yeah.
Oh,
We didn't have a...
There was no motion or
there was no motion, I'm sorry. There was no motion or second.
I thought you were making the motion.
No, I wasn't.
I move that the Board of Commissioners approve the contract between the Leelanau, the County of
Just lost it
Leelanau
today.
and the County Cancer Foundation, in the amount of $2,500, pending council review and approval, funds to come from the Grand Traverse Band 2% allocation award.
Second.
All those in favor?
Aye.
All those opposed?
Aye.
This motion passes 4-3. Commissioner Ansari.
On this topic, do we need to have a discussion about what we want to do in the future on this? You know, the board is divided, you know, on what we should be doing and what we shouldn't be doing. I'm just asking the question. I don't want, is there any interest in doing that again or not?
I'd be happy to, you know, in hopes that one of you would change your mind, you know, because that's really what it is. But the thing is we make an illegal legal by signing this contract, supposedly. I don't think we do, but our lawyers tell us that we do. But we don't ask them anything, and we don't give them any kind of guidance, and they do what they always have done. So that's, I mean, I don't know how that makes it legal.
If we do have that discussion, I'd like to make sure that we remember that just 2 weeks ago, or 3 weeks ago at the ceremony, the chairman of the tribe said that his priority, and they would be giving money for those applications that were supporting nonprofits. So if we choose not to do that, we're throwing money at Grand Traverse County and Benzie County and Antrim County, because they make the decision.
So
And
let's,
that is their stated
let's put it
priority.
on the agenda, because otherwise we're just gonna have a whole discussion right now. So I would agree to put it on next month's agenda. I mean, and then we can have this discussion at the executive committee meeting.
Perfect.
Thank you.
I don't wanna do it tonight.
I understand.
I can't hardly keep my eyes open now. Okay, so, all right, we're through with the contract, yes, now we're at the MAC dues. Commissioner Rushton.
Move that the Board of Commissioners approve the 2019-2020 Michigan Association of County dues in the amount of $10,930.26 with funds to come from a fund ending in 807.
Support.
All those in favor?
Aye.
All those opposed? The motion passes 7-0. Then Commissioner Rettenbach.
I move that the Board of Commissioners approve the changes and updates made to the county travel policy.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. Now we're to the vehicle auction.
And Ms. Evans has the updates on the auctions.
We got a total of $5,800 for a bid on the Escape and $6,601 on the Interceptor, as detailed in the draft motion.
Okay?
And the recommendation.
Commissioner Wesson.
I move that the Board of Commissioners approve awarding the bids on the retired vehicles as follows. 2012 Ford Escape, VIN number 1FMCU9DG3CKG56616 in the amount of $5,800 to Susan Anderson of Madison Heights, Michigan. And 2014 Ford Interceptor, VIN number ending in 3779 in the amount of $6,601 to Brian O'Boyle of Traverse City, Michigan. Final prices do not reflect the addition of a 6% sales tax or a 5% buyer's premium to cover the cost of listing the vehicles.
Second.
All those in favor?
Aye.
All those opposed? Motion passes 7-0.
Nicely done on that, didn't
Now we have review of financials. Any questions?
Yes.
Commissioner Lautner?
Yes, in late claims, first page, first. What was right at the top of the first,
And you're talking about the late edition?
late editions,
Okay.
first page.
First item was Allen Supply for $1,769.85. Is that the one you're talking about?
That would be it.
Building and grounds, surge, panic bar.
Didn't we, is this a second, didn't we just replace, what, I suppose we have several of them in the building, are they starting to?
What is that? I'm sorry, I didn't hear what.
The,
Panic bar.
Oh,
on the doors?
I check.
Okay, I just wanted to, it's a big expense.
We have several panic bars, yes.
Right, are they starting to, are they ones
Not
that
that
are
I'm aware of
used
it,
a
I'm not
lot?
sure.
Is that why they're breaking? Okay, I was just curious about that. On page 9, can you explain the Coble Hall tax, Jen?
Yeah.
Good luck.
I'd love to.
Well, why is it in there as an expense, I guess is my biggest.
A lot of times this actually will go through claims because it's, what happens is if the revenue comes in, so we discussed it at the last budget, when we went over
Yeah.
the revenues, the money will come in and only 50% of it is ours.
Oh, gotcha.
So typically we do this through
Okay.
post audit,
So
but we are
that's-
close. Yep, so this is, that portion of the money we received is 50% going out.
Okay, so it's just 50%.
Yep.
All right, and then on page 10, just out of curiosity, what are we painting yellow? I don't even know the vendor, I didn't look at the vendor, but we bought, okay, vendor is Seton Identification Products, but 2 gallon of yellow latex paint. I can't, we don't have that color anywhere that I know.
Probably the new stripes.
Oh, you think it's for the, oh,
that-
maybe it is, for the parking lot? No, it'd take more than 2
And
gallons.
I don't think we striped the part, I don't know if Jen has it.
It is striped.
Oh, it is?
Yeah.
Maybe it was striped.
Well, I mean, I think they're buying it to redo it.
Or maybe, okay, it could be the curbs.
The lines
The
or the
curbs,
curbs.
I bet, yes, okay, that would make sense. I didn't say we didn't have yellow
I'm
anyplace
just
else, so
guessing.
that, I didn't want to see one of these beautiful rooms turn up yellow next time I walked in the courthouse. So as long as it's outside, I'm cool with it. So, okay, that was it for me, thank you.
Any other questions? Commissioner Randall?
On claims, at the bottom of page 6, it goes into page 7, LEC roof ladder, cut roof access ladder, and make adjustments to ladder so workers can get access to ridge cap on the LEC roof.
Yeah, Jerry left, as I remember, he brought this up a couple of years ago. He was concerned about people getting to those units to service them. And he was gonna put some ladders in. He thought it'd be a good time to do it before they did the roof work. But I get some more details. I'm just going top of my head.
Okay, so it's because of what they're doing?
No,
or-
it was, yeah, he wanted to do it before they did the work. I think there's an issue, once again, I'm speaking top of my head from a couple years ago, to actually get inside the units and work on them, there's a gap. And he thought from a safety perspective, they were bringing these small ladders up there, and he wanted to get the metal frames built into it.
Okay.
How much was it for? And
$625.
$625. To who?
Leelanau County Customs LLC.
All right, I'll just put, I'll find out.
Okay. And then on page 9, or 8, I guess it is, the CDBG program, why are we paying them back?
I believe Trudy came and spoke on this.
What is it?
The
Community
This is
Development
the
Block Grant?
CDBG, so it's the unspent funds that you have to return to the programming from program income.
Yeah,
I thought Michelle mentioned to me that Trudy had come and talked to you guys about that.
I think she did. It's a change in the way the state does the formula.
Right, so I believe the grant time frame had run out.
Yeah, and part of it had to be sent
Okay,
back.
yeah, that sounds familiar now.
Yeah.
Okay, that was it.
Thank you, Jen. I think you're correct there. Yeah.
So, any other questions? Seeing none, then we do committee reports, recommendations, or resolutions. Commissioner.
I had made a request last week, and I was wondering if those reports were available for today.
On the early childhood?
Yes?
No, I've been gone, as you well know. I left last Wednesday, so I did ask Laurel. She went through minutes and she wrote down your questions on, and I have that list, so I'll put that on the agenda for next month.
I made it clear I wasn't going to.
Oh, that's official, you're not going to?
No.
Okay.
Any other comments, committees, or recommendations? Okay, how about special reports, staffs, commissioners, or affiliated agencies? Public comment. Any public comment today? You have to come up and state your name.
I got my technical questions answered as they left.
All right. No public
Thought I
comment.
had a shortcut, but it doesn't work.
Okay, commissioner comments. All right. Yes, I have that here. So then that comes to approval of financials. Yeah, before we do that, though, I'd like to thank Laurel for giving up her evening, for coming in and doing this again. I really do appreciate you being here.
And Jen.
Yes, and Jen.
Did you ride your bike, Laurel?
This traffic is
Working on the road.
something
Oh,
yeah.
They're making a new bike path for you.
That's true.
Real
Yeah.
nice one. All right, so then we'll go to amendments. We have amendments and transfers. There are quite a few here. Can you do them all together?
I would recommend approval of amendment numbers 19-006 through 19-0011.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0.
Would recommend approval of fund transfer 19-004.
Support.
All those in favor?
Aye.
All those opposed? The motion passes 7-0. Was there anything else?
Would recommend approval of claims and accounts $258,823.81.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0.
I would recommend approval of post audit claims and accounts $1,357,368.19.
Support.
All those in favor?
Aye.
All those opposed? Motion passes 7-0. We are adjourned.
Thank you all.
Thanks for sitting here.
Thanks for being here.
Good.
But can anyone tell me why Herman Road got re-gravelled in the middle of the 204